Hi there, I'm Anissa and I'm the Policy and External Affairs Manager at Epilepsy Scotland. Now, coronavirus has obviously greatly impacted all of our lives, how we see other people, how we travel and how we work. And the Policy Department at Epilepsy Scotland is no different. But we have tried to adapt quickly to our new way of working, and we've continued to push to make sure epilepsy has stayed on the agenda. At the beginning of the pandemic, health boards across Scotland were understandably reorganising their services to make sure they could cope with the coronavirus related demands. And as part of this, some epilepsy specialist nurses were removed from their epilepsy duties to work on the COVID wards. Now, we've been tracking the changes to services across Scotland, and although we understood the pressures felt by hospitals, as time went on, we were concerned that removing this really vital support was putting people with epilepsy at an unnecessary risk. Through our own survey work, we were conscious that seizure activity has actually increased in many people with epilepsy during the lockdown. So you have a situation where seizure activity has increased, but access to epilepsy specialists has become more difficult. So we wrote to all the Scottish health boards to really impress upon them the vital role that specialist nurses have in ensuring that people's epilepsy is well managed. And we lobbied them to make sure that there were ways that people with epilepsy could still access care, and also to reinstate the nurses, the specialist nurses, as soon as possible to their epilepsy roles. We want them to ensure they prioritise epilepsy care during the recovery phase. Now, following our letter, many health boards advised us that they were making sure people could contact and access epilepsy services, and that nurses would be repatriated to their epilepsy duties as soon as possible. And it's likely that some of these have happened sooner due to Epilepsy Scotland raising this issue. So we'll continue to push to ensure that people with epilepsy receive the care and support they need, despite the challenges of the pandemic. And if you have an issue that you'd like the Policy Department to focus on or to take up, please get in touch with us. You can get in touch by sending a message on social media or by emailing or calling the office. And we look forward to hearing you.